Have you ever paused to wonder what might really go through a doctor's mind when an older patient walks into the examination room? Most people never think about it. We trust that medical professionals will treat everyone the same, but the reality can sometimes be more complicated than we expect. Behind the friendly greetings, careful listening, and professional tone, some doctors carry quiet assumptions about aging in older patients. These beliefs are rarely spoken out loud, yet they can shape how symptoms are interpreted, how treatment options are discussed, and even how much urgency is given to certain concerns. This doesn't mean doctors are intentionally dismissive or uncaring. In many cases, these assumptions develop slowly through years of practice, time pressure, or common stereotypes about aging. However, when these ideas influence medical decisions, they can affect the quality of care older adults receive. In today's video, we're going to explore 5 surprising truths about how some doctors view older patients. Understanding these perspectives can empower you to speak up for yourself, ask better questions, and ensure that your health concerns are treated with the seriousness they deserve. Stay with me until the end because the final insight may completely change the way you approach your next doctor's appointment. Let's begin. Number 1. Some doctors assume many symptoms are simply part of aging. One of the most frustrating experiences older adults describe is being told that their health concerns are just normal aging. You might visit your doctor because you're feeling unusually tired, experiencing joint pain, or noticing changes in memory. Instead of exploring possible causes, the response may be something like, "That's pretty common at your age." While it is true that the body changes over time, assuming every symptom is caused by aging can lead to serious problems. Now, when concerns are brushed aside too quickly, real medical conditions may go undiagnosed. For example, persistent fatigue might be attributed to getting older when it could actually signal anemia, heart problems, or a hormonal imbalance. Memory difficulties could be dismissed as harmless forgetfulness, even though medication side effects or thyroid issues might be responsible. The risk is that once symptoms are labeled as just aging, the motivation to investigate further disappears. Often this mindset is not rooted in bad intentions. Doctors frequently work under intense schedules, seeing many patients each day. When familiar symptoms appear in older individuals, it can be tempting to assume the most obvious explanation. However, the simplest explanation is not always the correct one. There have been many cases where treatable conditions, such as depression, vitamin deficiencies, infections, or even early-stage cancer were initially overlooked because symptoms were attributed to aging. I once heard about an elderly gentleman named Robert who began feeling extremely weak and dizzy. His physician initially suggested that slowing down was simply part of reaching his 80s and recommended more rest. But Robert sensed something was wrong. After insisting on further testing, doctors eventually discovered he had a heart valve issue that required treatment. Once the problem was corrected, his strength returned, and he resumed many of his daily activities. His story is a reminder that aging should never be used as a blanket explanation for every physical change. No matter your age, unusual symptoms deserve proper evaluation. A persistent cough, unexplained weight loss, sudden weakness, or changes in mobility should never be ignored simply because someone is older. Advocating for yourself is essential. Ask questions. Request clarification. If necessary, ask for additional testing. Your health deserves the same level of attention and investigation that would be given to someone decades younger. Number 2, some doctors believe older patients may struggle to follow treatment plans. Another quiet assumption that exists in healthcare is the idea that older adults may have difficulty managing complicated medical instructions. This belief can come from stereotypes about memory loss, hearing problems, or confusion around medications. So because of this perception, doctors may simplify treatment plans or avoid suggesting certain therapies altogether. While simplifying care may sound helpful, it can sometimes limit the options available to older patients. For example, a physician might avoid prescribing a more advanced treatment because they assume it would be too complicated to manage. They may also skip detailed explanations about lifestyle changes or medication schedules, believing the patient might find it overwhelming. The problem with this thinking is that it treats all older adults the same. In reality, many people in their 70s, 80s, and beyond remain highly organized, mentally sharp, and capable of managing complex routines. Some track medications carefully, research their conditions online, and actively participate in decisions about their care. When doctors assume older patients cannot handle detailed instructions, important opportunities for better treatment may be missed. I once met a woman named Carol who was diagnosed with a heart condition at 79. Her first doctor offered a very basic treatment plan and did not go into much detail. Carol later switched physicians. Her new cardiologist explained every possible option, including medication adjustments, dietary changes, and exercise strategies. With that information, Carol created a routine that dramatically improved her health and energy levels. Her experience shows the importance of communication and involvement in your own care. One helpful strategy is to demonstrate your engagement during appointments. Bring a notebook, write down instructions, and ask for clarification when needed. When doctors see that you are attentive and committed, they are more likely to share detailed treatment options and trust that you can manage them effectively. Ultimately, following medical advice has little to do with age. What matters most is understanding, support, and clear communication between doctor and patient. If you're still watching and finding these insights useful, comment 2 below to let me know you're here. And if you haven't already, consider subscribing and turning on notifications so you don't miss future videos designed to inform and empower you. Now let's continue. Number 3, younger patients may sometimes receive more attention. This is a difficult truth to discuss, but in certain situations, doctors may unconsciously prioritize younger patients. This can happen especially when time, resources, or treatment availability are limited. Some physicians believe younger individuals have more years ahead of them and therefore more to gain from aggressive medical intervention. As a result, older patients may receive less urgency, fewer follow-up tests, or fewer treatment suggestions. This bias is rarely intentional. It often arises from deeply rooted ideas about life expectancy and long-term outcomes. However, this reasoning overlooks something very important. Quality of life matters at every age. A person in their 70s or 80s deserves the same opportunity to remain active, independent, and comfortable as someone much younger. When treatment decisions are based primarily on age, valuable opportunities for improving health and mobility may be missed. For instance, an older patient experiencing severe pain might be told that surgery is unnecessary because of their age. Meanwhile, a younger patient with similar symptoms might be offered a full range of diagnostic tests and procedures. Sometimes doctors assume recovery will be too difficult without fully discussing the option with the patient. I once heard about a man named Richard who began suffering intense knee pain in his early 80s. His doctor initially discouraged knee replacement surgery because he believed the recovery process would be too demanding. Richard decided to seek another opinion. The second surgeon evaluated his overall health rather than focusing solely on his age. After careful assessment, Richard underwent the procedure. His recovery went well, and he returned to the long daily walks he loved. His story highlights an important lesson. Age should inform medical decisions, but it should not automatically limit them. Your physical condition, motivation, and personal goals are equally important factors. If you feel that your concerns are not receiving the attention they deserve, it is perfectly reasonable to ask more questions or request a second opinion. Advocating for yourself can sometimes make a powerful difference. Number 4, doctors may underestimate the importance of your personal goals. Another subtle issue that affects many older patients is the assumption that their ambitions are limited. Some physicians may believe that older adults are primarily interested in comfort and stability rather than pursuing meaningful activities or future plans. Because of this, treatment recommendations may focus only on maintaining basic health, rather than helping patients achieve personal goals. For example, if someone mentions knee pain, a doctor might recommend simple pain management without exploring treatments that could restore mobility. Yet many older adults still dream of traveling, gardening, volunteering, or spending active time with family. Medical care should support these goals whenever possible. I once heard about a woman named Ellen who lived with chronic lung disease. Her dream was to visit her granddaughter overseas. Her doctor initially encouraged her to focus only on staying comfortable at home. But Ellen sought another physician who helped her create a training plan, adjusted her medications, and prepared her physically for travel. 6 months later, she successfully made the trip. That experience became one of the most meaningful moments of her life. The lesson here is simple. Your dreams and priorities do not disappear with age. If your doctor does not ask about your goals, share them anyway. Explain what activities matter to you and ask how your treatment plan can support them. When doctors understand what truly motivates you, they can often tailor care in ways that make life more fulfilling. If you're still here with me, comment 4 below. Your engagement helps us continue sharing helpful content. Number 5. Emotional health is sometimes overlooked in older adults. The final truth involves the emotional side of aging. Medical care often focuses heavily on physical symptoms like blood pressure, cholesterol levels, or mobility problems. But emotional well-being plays an equally important role in overall health. Older adults often face significant life changes, including retirement, loss of loved ones, reduced independence, and social isolation. These experiences can lead to loneliness, grief, or anxiety. Unfortunately, emotional struggles are sometimes dismissed as a normal part of growing older. Doctors may focus solely on medications or physical symptoms without exploring how patients are coping emotionally. Yet emotional health has a powerful influence on physical well-being. Stress, sadness, and isolation can affect sleep, appetite, immune function, and recovery from illness. I once heard about a man named Leonard who lost his wife after more than 50 years of marriage. After her passing, his health began to decline. Doctors adjusted his medication several times, but no one asked how he was handling his grief. Eventually, a friend encouraged him to seek counseling. With emotional support, Leonard began to heal. As his mental health improved, so did his physical condition. This story highlights an important truth. Emotional well-being is an essential part of healthcare. If you are struggling emotionally, share that information with your doctor. Speaking openly about loneliness, sadness, or stress provides important context for your care. A compassionate physician will recognize that treating the whole person includes both physical and emotional health. Final thoughts. Learning about these realities may stir many different emotions. Some people may recognize these experiences from their own doctor visits, while others may find the information surprising. The purpose of discussing these truths is not to criticize doctors as a whole. Many physicians are deeply compassionate professionals who work tirelessly to help their patients. Instead, the goal is awareness. When you understand the possible assumptions that can exist in healthcare, you become better prepared to advocate for yourself. Your voice matters, your concerns deserve attention, and your life experiences are valuable. Aging does not reduce your worth or your right to excellent medical care. The best healthcare outcomes often happen when doctors and patients work together as partners. That partnership begins with open communication. Ask questions when something is unclear. Share your goals. Speak honestly about your symptoms and emotional well-being. When you take an active role in your healthcare, you help create a stronger and more respectful relationship with your medical team. Remember, your story, your wisdom, and your life experiences remain incredibly important, and you deserve medical care that recognizes that at every stage of life. Thank you for spending time with us today. If this video resonated with you, please share your thoughts in the comments. Let us know one idea that stood out and how you might use it during your next doctor's visit. Your feedback encourages us to keep creating meaningful content that informs and empowers our community. If you found this video helpful, please like, subscribe, and share it with someone who may benefit from hearing these insights. We appreciate your support and look forward to seeing you in the next video.